Good morning. My name is Dr. Melody Medley Keith at Lakeway Aquatic Physical Therapy, and this is our Snapinar on hip pain relief. So for those of you that have had hip pain or still having hip pain from either osteoarthritis, you've been told, oh, you've got arthritis, bursitis, tendonitis, any kind of just a muscle injury that you have within the hip joint, and you feel it in the hip and up here. Sometimes it comes up into the pelvis, and sometimes it goes down into the knee. Or it may just stay in the hip. So for those of you that have been told, okay, you've got a hip problem, and you've tried things over and over again, I'm here to tell you to come to the pool. Why do we love the pool? Is because that we love to unweight the body and allow the hip joint to move. And that's one of the two things I want to give you today in our Snapinar. Okay, again, for those of you that have not watched this before, we'd love a little thumbs up. If you can give us a comment, that would be awesome. Okay, that kind of lets us know where we're at and what's going on. For those of you that want even more information, you can come into the clinic. We're located in Lakeway, outside of Austin, Texas, for those of you that are interested. Okay, now, for our two things we're thinking about, okay? Range of motion. Now, when you think of the hip, you want to think of big steps. So what I'm talking about here is I want you to get into the pool and not just walk, but I want you to think range of motion. In my hip, I want to try to go as big as I can. Now, if you get big and you start going forward, backwards, sideways, right, and you start going big, too big, it doesn't feel good, just do whatever you can do. Again, you want to walk for about 10, 15 minutes, forward, backwards, and I'm trying to walk as big as I can, trying not to use the upper torso, trying to just big steps. And then the other one is your side step, right? Forward, backwards, sideways, as big as I can. And look on that side step, how I always kind of call it like you're picking up your leg and kicking it out, almost like a big karate kick, getting that hip range of motion in there. All of that is super important. Super important. So it's forward, backwards, sideways. Then the other one I'm going to give you is toes in, toes out. We call it pigeon toe. And notice how I'm really working on my posture. That's what the dumbbells are for. Working on my posture. I'm going toes in, and then I'm going to go walk a little toes out and really try to get my feet and toes out while I'm walking. Okay? So range of motion. Get that hip moving. All right? The second thing you want to think about is you want to do things that are going to help above and below. What do you mean by that, Melody? Well, again, the hip joint connects into the pelvis. You've got to do some pelvic stuff. And then guess what? The knee and the ankle connect into that. So you've got to do knee range of motion. You've got to do hip and pelvic range of motion. And there's no one's better than what we call horse ride, right? And you just get on a nice solid noodle. You get those big fat ones. They're great for it too. And you're just going to ride the horsey and get in and move. Get that knee moving. Get that ankle moving. And then what the pelvis does is it moves while you're on the horsey. For those of you that are not real good in the water, you're not real sure, then just stay in the shallow. See how I'm kind of every once in a while touching the bottom to maintain my balance. But again, the whole thing is to get the pelvis moving forward, backwards, and sideways on the horsey. And if you want to use your dumbbells with this, that's fine too. Anything that you can use to kind of get in and get moving so that you make sure that you're unweighting the hip, allowing it to heal, getting in the water to heal and move, get the movement, get the range of motion, and get above and below, the joints below and the joints above to move as well. And this will help your hip and allow it to heal for a couple of weeks. Get into the pool. We're starting in the summer. Let's go do it. If you have any other questions, we love to hear from you. Thank you so much. Have a great day. Bye-bye.